All right, good afternoon, everyone. This is Pat Ryan here with Dr. Michael Doyle, who leads the HealthAlliance of the Hudson Valley. Really appreciate you making time, Dr. Doyle. I know I actually can't imagine how busy you are right now, so we appreciate it.
I can't imagine how busy you are right now, and really thank you for your leadership during this time. It's been a pleasure and honor working with you these past few weeks, and I look to continue this relationship. It's phenomenal. Thank you.
In another life, I would be saluting Colonel Retired Doyle. We share an alma mater, and growing up in military service. So
yeah, thank you.
It's good to know that you also have way more experience than I do, or probably many other folks around, in terms of responding to disasters, medical emergencies. You were telling me you were on the Comfort at one point, right? A long time.
Well, it was in a hospital where the physicians left to go get on the Comfort.
Oh, okay.
I got left behind. They went there.
Okay.
It's fine.
Okay,
But,
got it.
Yeah.
Well, and to everybody tuning in, thanks for making time. It's been a few days since we did some updates, so I'm going to start with a few updates. We've got more slides to try to help better show what's happening and share information on what's happening, and then we'll turn it over to Dr. Doyle for a bit and then answer questions. And I really want to thank our team that is very generously translating in sign language. We're continuing to try to improve every day and making sure every single person can see and hear what's happening. We're also translating into Spanish language as well. So we're doing our best, and thanks to everybody for the feedback to help make that happen. So we'll start with the numbers. If you would throw up our latest graph, please. So right now, we continue to see the number of positive cases go up. As I've said, we have expected this, especially as we ramped up testing. We're currently at 222 positive cases out of 1,370 tested. So we're still hovering around that 15-ish% of total tested coming back positive. We're not going to share exact numbers of those hospitalized, but we're at about a 10% hospitalization rate of positive cases. Just as a reference point, New York City is at about 20% of positive cases hospitalized. So that's just a comparison point there. You can see a very slight decline in the slope of growth. Dr. Doyle and I were just talking about this. Hard to tell if what's driving that, to be honest, and I don't want to speculate too much. It could be that we're flattening the curve. It could be that testing is just lagging a little bit. So we don't know, and I don't want to get too far ahead of ourselves. But we obviously hope that the work that we're doing, that everyone's doing, to stay home and follow all the protocol will slow that steepness of that curve. The latest New York State projections, which the Governor Cuomo shared this morning, talked about a apex or a peak of maximum cases statewide now at the end of April, which would be about 4 weeks away. He went through and talked about the fact that that's based on several different predictive models coming together. So again, there's no perfect science here, but I did want to share that for those of you that didn't see that from him, that at a minimum, we think we are going to continue to likely see this build and grow, unfortunately, in the short term. On the testing front, continued good news here in Ulster County and in the region. If you want to throw up the next slide, please. So in this regard, we now have 2 mobile testing sites up, one in Kingston, town of Ulster, technically, at the former Tech City, one down in Ellenville that we opened this week. I really want to thank our healthcare partners that made that happen, the team of nurses and medical specialists and others that are out there, law enforcement that is protecting and keeping that site secure. We've seen our testing numbers go way, way up. Now we're doing hundreds, if not thousands, per week, on pace to do that. So we think that's critical to keep upping that, to be able to have a better sense of what's happening on the ground. I specifically want to thank Ellenville Regional Hospital. I was down there 2 days ago with Steve Kelly and his team for making that second testing site happen. And now folks in the southern part of Ulster County have a place that they can get to more easily and safely. So we really appreciate that. If you throw up the next slide, please. I just want to take a second and emphasize the seriousness of what we're dealing with here. I mean, I know that it's now basically a month into this pandemic and crisis, but I do think it merits just taking a second. Unfortunately, we've now had 3 Ulster County residents succumb and die from complications related to COVID-19. One of which at HealthAlliance, and then 2 others at other area hospitals. There's really no words that we can use to capture how heartbreaking that is. And unfortunately, I think there's more of that coming. As we see the trends continue to grow, we're obviously doing everything we can to stop that. We're doing everything we can to send love and positive thoughts and prayers to the families of those, not just that have lost loved ones, but that have loved ones right now that are in our hospitals hanging on. And so let's continue to do that. But at the same time, I want everyone to recognize that all the regulations and the policies that the governor put in place for the state, the Pause Act is still in effect. And we do continue to get reports of folks not following that. I know it's tough. I know we're asking a lot of you, but it's absolutely deadly serious that we follow these protocols to keep everyone safe and healthy. And the sooner we can do that, the sooner we can get through this with the minimum impact possible. Every single person, as powerless as you may feel in the midst of this, does have a role to play. It's a little bit weird because for many folks, that role is to do as little as possible, but that actually is actively contributing to keeping the community healthier and safer. The last thing that I did want to announce, we've got a lot of feedback from and questions from our town supervisors. We're doing a daily call with them, particularly concerned now that we're getting into the spring and the summer about campgrounds, bungalow colonies, children's camps. I've directed Health Commissioner Dr. Carol Smith to put out a letter to all of those facilities which are licensed through our health department that we will not be issuing any permits, at least for now until the situation changes, for those types of facilities. That is not a decision we made lightly, but one that we think is critical given the significant density and concentration of folks on those campgrounds and bungalow colonies, the shared facilities, bathrooms, water, and so on, and just really the density. So we'll be putting that out in an official letter to all those facilities. If you have questions on that, obviously, you can reach out to our health department and they can answer those questions. But that's an important new policy that we're putting out to keep everyone safe as we head into the beginning of that season. All right, next slide, please. So Dr. Doyle, please jump in here in particular. One of the things that we've tried to do, that I've tried to do, is based on the projections we're getting from the state as well as our projections on the ground, is set some goals and some parameters for what we think we need to meet that surge that we now expect towards the end of April. It is not a perfect science by any means, but ultimately at the high level, I've called for us to quadruple our hospital and medical treatment capacity. And you all at HealthAlliance have been really on the front end of this, and we appreciate it. Just to talk about some of the numbers. So what you see on the graph in front of you, there are 3 columns there. The first column is what we currently have in terms of capacity. The middle column is what we have plans in the works to get to. And then that final column of what we need is that projected number based on likely surge of where we, ideally at a minimum want to be. So in terms of hospital beds, we have been able to add about 25 between our local systems to get us to 125 currently. But the big lift here and the big news that we can talk about now, or we can talk about more later, is the addition of 235 beds at HealthAlliance Mary's Avenue campus.
Right, and thank you, Pat. So to talk briefly about that, we were selected by the governor, among a few other hospitals in New York, to really meet the growing needs of New Yorkers for hospital beds. Yep. And we have a great resource in the Mary's Avenue campus that is there, and that we can expand and create space in to meet that need and the goals of the governor around and the local goals here to provide care, for our residents, for our community, for the greater New York area here, in this time. So it's a temporary measure. Okay, it's certainly not a permanent or long-term, plan, but we do have the ability to phase in a number of, medical units there on the Marys Avenue campus as, needs and demands require to build to that capacity, with there another 235 beds. And we're very excited about it hey, we've got to do our part, and we're being called on to do this. It's grim, it's not something we want to do, but we can, and we're going to live into that mission.
And that's a huge, for Ulster County, for the region, that is a huge capacity increase that basically, that would get us to 360 towards our goal. Can you talk, I know we're early on here. We were there on, was that Saturday or Sunday? Saturday.
I've lost track.
Yes, whatever day that was. It was Saturday, I think. And you walked myself and some of our team through that campus. Could you talk about what you told us in terms of the ability to kind of phase that in, that some of that capacity is pretty close to ready, but others will take a little more work?
Correct. Yeah, so, the campus itself is active, has active patient care going on. We have a number of disciplines there, some of which will, relocate and displace to other, venues within the health system, WMC Health, because as the governor said, we got to work as a system. And so we have that capacity. And so those care operations will continue at another site. So those units are active units, ready to go. One of the units is, was where we held patients for elective surgery. Well, we're not doing as much and really not able to do elective surgery right now. And so that's not an active unit. So we can immediately, with staffing and other equipment, fall in on that. So that would be one of the early units to go live. Okay. There are a couple other units on the floor that are in very good repair and just need equipment. Okay, IV poles, beds. And so, as we move into that and with support with the state, those units can come online. And then there's some other units that have been, either in disuse or other use that we'd have to change over or, convert to medical care. And that'll take a little longer in partnership with the state to get those units, up and running, over the course. And we're looking, through the month of April in doing that.
And, I think what I know keeps both of us up at night to a certain degree is if the apex is towards the end of April. I mean, I'm encouraged by what you've said and what we've seen that, we have some time to work with here. We've got a few weeks to build that capacity.
And that's been, our mantra in many ways in planning at the hospital, not just on the Marys Avenue campus, but even the Broadway campus where, we're very focused there on, taking care of, Ulster County patients, right here, right now. And, as we monitor, the numbers that you present, we see in that, space to ramp up and hone our operations. And we're doing that on a daily basis also, on the Broadway campus. So we've got this mission on the Marys Avenue campus, while we've got a phenomenal care team, absolute, salt of the earth folks who love their community, are passionate about providing health care right there on Broadway, taking care of those patients who come in every day. And so there's a lot of capacity there, too, to meet the needs we have right now. So it's good.
And one of the other pieces to this, which you alluded to, Dr. Doyle, is not just, there's other numbers we'll run through in a second, but the beds are really, in some ways, the easier part in terms of physical space. The real challenge is great healthcare workers who are already putting their lives on the line on a daily basis, and getting the right folks in, making sure they're healthy and safe, making sure they're rested, making sure they have the PPE and equipment that they need. And we've been partnering really closely on that. The state has been obviously heavily involved, and we got another big supply of PPE just on the way right now. But can you talk a little bit about that and how that's going?
We've been well supplied, both supported by the county, the state, WMC Health Network, in terms of ensuring that our staff and our patients have the necessary personal protective equipment they need. We've got the masks, we have the gowns, we have the N95 masks. There's no shortage in our supply lines, and yet daily we're analyzing that and we're going back to our suppliers. With that, we still have to work closely with staff and visitors, patients who come in, to ensure we're using the equipment properly and being disciplined in the use and rigorous in that. And we follow all the CDC guidelines related to this. You know, we're not going off the reservation, you know, on this. I mean, this is
good.
very
That's good.
very tight.
Yeah.
And because of that, and because our understanding changes, sometimes you know what we do today may change later in the week because we have a better understanding of the disease or the other best practices that we've learned, you know, from New York City, from other areas in the country, on
Right.
how they have managed their PPE
Right.
to get through this. And so that's all, you know, gets incorporated into our decisions about, you know, mask discipline and how we wear the masks and when we wear it.
Yep.
It's been very good, and our staff, they're embracing this. You know,
Yeah.
they want to do what's right and make sure they're there every day to take care of patients.
Having been a patient, not recently, but at the hospital, I can say the staff is just incredible, and I just want to thank every healthcare worker, not just here in Ulster County, but you know, we've got some of our residents in Dutchess County and other in Orange County. We have just heard heroic stories about every healthcare worker. We know they're going to be taxed even more, and just know that we're here as a county, and I know the leadership of the hospitals to have your back, and you know, just know that we're everybody's working as hard as we can to keep you safe. I yesterday was just getting a sandwich and from a distance ran into the mother of a healthcare worker, and it was a hard. She actually teared up a little bit when she talked about her daughter going into work and how worried she is about her daughter. But she did say her daughter felt like she was getting the support she needed. They felt safe, as you know, as protected as they could be.
Right.
So that's, you know, I know it's very personal for a lot of people in our community, and we have that in mind. Other, just to go back to the data for a second,
Yeah.
Other updates, we are working not just to up the total number of beds, which is important, but also to focus on ICU capacity, ventilators. We've been able to secure a few more ventilators. You know, you all have been able to do that, which is huge.
Yep.
The other thing that I want to talk about, beyond these numbers of hospital beds, ICU beds, ventilators, excuse me, step up and step down beds. So what we mean by this is, and I may be using the wrong terms, but really non-critical care that would be done in the hospital. How do we add more capacity if needed in more of a field hospital type of a setting? So we've been preliminarily planning at the county level in coordination with HealthAlliance on how we might do that. I've set an initial goal of having up to 200 additional beds. This would be for either pre or possibly post-hospital additional surge capacity, something we hope we wouldn't need, but that at least we want to be leaning forward and ready to do. So right now we have a plan that we're working to add 100 of those in the next few weeks, and we'll also look to possibly get up to 200 if needed. The goal there partially is actually to keep people out of the hospital until they really need to be there in anticipation of a surge, as well as folks are able to get out of the hospital, as we see more people recovering, that they have a place that they can go to free up those important beds in the hospital, but still have some care and be able to isolate if needed from family members. So I know that's a lot of numbers, but I do want people to understand that we are using data and projections to really inform all the work that we're doing in close coordination with you all. And it's not a perfect science, but we feel pretty good about this plan and know that we're working hard. We've got a team out right now looking at a site, and we'll keep everybody updated on that. Anything you want to add on all that, the numbers? And
No, I want to go back to one of your messages earlier on. This is serious. I want to thank all of the community members out there who are following,
Yes.
the guidelines, because
Yes.
that makes it so much safer for our staff at the hospital, to do that. I mean, that they're able to focus on the mission and do that. So I thank our community members who follow that, do the social distancing. It's hard, but that helps the hospital so much when folks really adhere to that, and I appreciate everyone out there who does that.
That's a more positive way to do it than me trying to shame people into doing it. Let's thank the people that are actually doing it.
No, they're doing a great job.
I appreciate that. A few more updates, and then we'll open it up. I know we have questions, quite a few questions coming in here. So if you could go to the next slide, please. We're now basically a month into this crisis, and I do want to take a second and just talk about the economic impacts. There are a lot of businesses now that have been closed for a week or 2 weeks. There are a lot of families that for almost a month, up to a month, have not been receiving income because they were either temporarily or full-time laid off. Rent payments are due at the beginning of the month. I'm mindful that today is April 1st, and that adds just another layer of pressure on the shoulders of a lot of our residents. So I'm not going to go too in depth now on these, but know that we're working a few different things here. So, number one, in terms of resources for our businesses, we're doing a weekly check-in with our economic development team, all of our small businesses and not-for-profits. In particular, there are two important programs that we'll be sharing information on. The first is, they're both federally funded. One is the Emergency Disaster Loan, EIDL program, which is ramping up. And the second is the Paycheck Protection Program, also funded in the new federal legislation. There are billions of dollars that will ultimately be flowing down to us. And just know that our economic development team here in Ulster County and our SBDC, small business team that serves the county, are gearing up and already working with businesses to get people queued up for those programs. At the direct family level, where I know there's a ton of pressure, I want to thank our federal delegation, our congressional delegation, Congressman Delgado, Senator Schumer, and Gillibrand for fighting to get money both directly into the pockets of families with some checks that are going to be coming in the next few weeks as we hear it, as well as to add significant new benefits to unemployment insurance. So we are seeing the numbers of unemployment claims go through the roof. We are working with the state to help figure out how they can help folks navigate that process more quickly. We know there's a bottleneck in applying. Governor Cuomo has said he knows it too. They're working on it at the state level. So know that we're working on that. And then finally, something new and significant that I want to announce today, or really ask for today, given the pressure, particularly around rents for many folks. We've gotten a lot of calls from people that, believe it or not, in the midst of all this pressure and craziness, certain landlords are actually trying to raise the rents on their tenants, many of them seniors, many of them families that are already under pressure. So I am calling for a county-wide rent freeze at a minimum to hold rents and ensure that no one's taking advantage of those in this time that are renters and trying to add to that burden. That also reinforces the state restrictions on no evictions, as well as the 90-day moratorium or pushback on mortgage payments. So that's something we're doing at the county level to try to reinforce that and relieve some pressure for folks. And I want to thank several of the town supervisors. Supervisor Jim Quigley, in particular in the town of Ulster, suggested this. I know Legislator Abe Ucatel, county legislator, suggested this, so thank you for that idea, and this is something that we're going to try to call on and make happen. Final update, a little bit of good news. Our Project Resilience, if you could go to the next slide. This is the one thing that continues to make me smile in the midst of a lot of challenges and pressure. Some of the numbers here you can see we've now crossed a significant threshold of in under 2 weeks, over 10,000 meals delivered to families across the county. This is really in partnership with town leaders, food banks, not-for-profits like People's Place and ARC and so many others. Over 1,500 households are now regularly getting critical food. Many are receiving daycare, our healthcare workers and first responders. And we're keeping money actually flowing in the local economy because we're paying at cost local restaurants to prepare this food. We're trying to capture some of the cool photos and stories coming in. I just want to quickly share one photo that I happen to see and I don't have it for the screen. I'm sorry. I'm just going to read this. So there was a photo that one of our volunteers, we've got hundreds of volunteers out around the county delivering these meals, putting themselves at risk, by the way, too. So thank you to them. And one of the volunteers went up to a door to drop off some meals, and there was a little note, and it said, "We are 90 and 80 years old. This delivery is a blessing. Thank you. Be safe," and a little smiley face drawn at the bottom. And I just thought that was pretty powerful and pretty cool. And we've had dozens, if not hundreds, of those kind of positive moments of community stepping up. And so I just want to thank everybody that has contributed to Project Resilience. We're now well over $2 million raised into our community fund. All the restaurants that have helped. I saw yesterday Savona's restaurant, after unfortunately having a break-in, the day after, still prepared hundreds of meals of great food to get out to our community residents. So it is pretty cool and reflects the values of our county and our community. So thanks to everybody on that. I'll hand it to you quickly to add anything else, or we can dive into questions. Do you want to add anything more about what you all are seeing, what's happening on the ground at the hospital, or?
Yeah, I mean, what I'm seeing at the hospitals, Kingston, Ulster County, I mean, you have, and we have just such great neighbors, friends, family who work there and provide, phenomenal care for your friends, neighbors, and family members. And these are passionate folks who are committed to this community and ensuring that we continue to deliver safe and effective care. And it just amazes me on a daily basis what they're doing and what they're able to do, how so many have lifted and shifted from what they were used to doing. Our ORs are, not humming right now, so
Right.
We have OR nurses, training in critical care because we expect we'll need that. We have OR techs and physical therapists out scrubbing the halls, all the high-touch surfaces, just making sure they start at the top of the hospital in the morning, they work their way down, they do it 4 or 5 times a day,
Wow.
cleaning that and making sure that, we continue to provide a safe environment. This has just been a real resilient group that's risen to this occasion, and it's just an honor to work with them on a daily basis. What a fantastic team we have there.
Well, and it's a credit to your leadership, Dr. Doyle. You're a very humble guy, but I know I feel in good hands, and everybody in the county should feel in good hands. A proven leader who's seen some pretty intense things before in many different jobs, so we appreciate it. I'm going to throw some questions out there. Some of them will be for you. So I'll try to answer some. If we can't answer, we'll get back to you. A quick one logistically. What about people that don't have cars? How can they get to the testing? This is from Brenda. How can they get to the testing sites? Cabs will not transport us. It's not safe to take the bus. Great question. If you are not able to get to a mobile testing site, call our COVID-19 hotline. We can either figure out a way to get you there, or we can send our public health nurses to you if that is the best and easiest solution. So that should not be a barrier to being tested. That COVID-19 hotline is 845-443-8888. So thanks, Brenda, for that question. Here's one for you, Dr. Doyle, from Joan Benedictine. People still keep calling it that. I do sometimes too, sorry. Mary's Avenue campus has an infusion center on the 4th floor. How will converting the hospital to COVID-19 impact those vulnerable cancer patients getting chemo and radiation? Yeah,
very good question, and it's one we're working on right now. We will remove the infusion center from the main hospital tower and relocate it on the Mary's Avenue campus, more than likely. That's what the current plan is calling for. We're assessing the feasibility of that.
Yep.
We think that's the best plan right now, but certainly that may change. It may end up on the Broadway campus. But we agree that we really want to make sure that our vulnerable patients are separated from and distinct and from those risks that may be posed by an infectious process like that. And but yeah, we plan.
But the plan is absolutely that those folks will continue to be able to get care.
Absolutely.
And that their safety will be looked out for.
Yeah, both of those are driving the analysis. How do we continue to provide care, and how do we do it in a safe, effective manner?
Yep. Great, thank you. We talked about this a little bit, but maybe you can expand on it. Question from Ruth. What is the status of our hospital and medical staff for PPE? Lack of PPE increases risk of infection to these greatly needed people and is putting their own families in danger as well. You talked a little bit about it, but
Yeah.
I know, the stories we're hearing out of New York City are dire, and it sounds like you feel very confident where we are right now. And
Right. Yeah, and I'll be honest. I mean, this is something we've had to ramp up. So we have very good supply, and we work to make sure on a daily basis that everybody has the supply they need. They know how to use it. That we're trained effective in its effective use.
Yep.
And that's an ongoing mission every day to ensure that. So
Yeah. Good. So that's definitely reassuring.
Yeah.
This is, and you may not feel ready to answer this. Dr. Smith isn't able to be here, our health commissioner, but Alan asked a question that I think more folks are starting to ask. Is there any information about those that have recovered? Can they get the virus again? How does that all work to the degree you're able to?
Yeah, I really don't know. I
Yeah.
mean, I think that I'd have to defer on that one.
Yeah. I don't want to give a
Right.
I definitely, if you're going to defer, I'm definitely going to defer. we don't want to give bad information, but Alan, we will, I'll have Dr. Smith take a swing at that, and we can share it on Facebook, or we can figure out how to direct message it to you. We have your question here. I'm sorry that we can't answer that right this second. Here's a few more. Okay, so here's one we've heard a lot. I'll take a first stab at it, and feel free to jump in. This is from Travis. Is there any truth about patients coming from the New York City area to Ulster County? I've gotten a lot of questions about this and concern, and rightly so. I mean, I've been saying we're already worried about our capacity for our county residents and the region's residents between Dutchess and Orange and our surrounding counties. So that's a very logical question. My understanding, and I've been in regular contact with the governor's office and leadership there, this additional capacity for HealthAlliance is really about our region. There's been major investment in the city in terms of a 1,000-person hospital in each borough, the Javits Center, some facilities on Long Island, a facility in Westchester. So the idea is here, when you look at the state map and you see the numbers now starting to go up in the Hudson Valley, we want to get ahead of that and provide regional capacity here. I don't think it'll be exclusive to Ulster County residents, because obviously we have patients coming from Greene County or Dutchess County or even Columbia County possibly, or Sullivan. But the idea is that this is regional capacity. Obviously, my job is to think about the residents of the county, but I also recognize we have a role to play in the region. We're all interconnected. Many of our families span the counties. And so that's my answer to that one. But know that that's something that we're watching. And I will make it very clear that we are already under pressure here in terms of beds, staff, PPE, and that I feel very strongly that we need to fight for that for ourselves here, and I will continue to do that. I don't know if you want to talk any more about that.
No, I think that was fine.
Okay.
Let me just, as I think about it though, we're going to stand this up, but we're not going to have beds just sitting empty.
Right.
I think that would be a disservice, and that would be, so we really have to manage that well. Okay, so.
Yeah, and I think, look, I mean, this is an unprecedented situation.
Yep.
If we are not, our values, my values, I'll say anywhere, I mean, we're not going to turn folks away that are literally dying. I mean, obviously, if we can help and we have extra capacity after taking care of our folks here, we will obviously do that. I mean, that's the right thing to do.
Correct.
But that's how we're thinking about it. But it is an ever-changing for sure.
Yep.
And that's also part of the idea of beyond the bed capacity at the Marys Avenue campus, why we're also looking at that. I have our county team looking at the surge field hospital model to add even more capacity so we can make sure that we're taken care of here. All right, a few more coming in here, and then excuse me, we should probably let you get back to more important things here.
Well, the team over there is doing such a great job. I think my job is just stay out of their way right now.
Okay.
So, yeah.
That's what I try to do sometimes, too. Here's a question. We've gotten lots of good suggestions about sites for additional capacity. Folks have, Sarah is suggesting Coleman High School. Others have suggested other sites. We are looking at a bunch of different sites. There's a lot of needs from utilities to electricity to HVAC and air conditioning, so we can make sure if it gets hot we can control temperature, making sure there's kitchen facilities. So I appreciate all the suggestions. We've had many folks reach out, and then we'll make the best determination based on all the different criteria. The good news is we've been learning from what others are doing across the state. We are seeing the learnings from what's happened at the Javits Center, the learnings from other places. I'm in regular touch with our surrounding county leaders and what they're doing in Westchester. So we'll be able to actually benefit from those lessons learned here and replicate the things that have worked there, and the things that haven't worked we can tweak. All right, you got time for like a few more, and
Sure.
then we can, all right, thank you.
I don't even know.
All right, I don't know, we may have to defer a little bit on this one, but this is one that I know my wife was asking me this morning as we're running out of groceries. And by the way, we are literally down to one roll of toilet paper if anybody's got a roll for a lifeline. Our household is, I might be calling you, Dr.
Well,
Doyle.
I had a very funny text this morning. A friend of mine texted me that as I knew, Costco was giving away rolls of toilet paper
Really?
to be driven
Oh,
by a truck. They'll be delivered to your house at 1 o'clock today. You have to call all your neighbors and let them know they're coming. Tagged it with April Fools.
Nice.
Okay.
Got
no
it.
truck from
All right.
Costco coming to my house.
All right,
Yep.
got to have a little fun on April Fool's Day here.
Yes.
Jane asked, in seriousness, is it safe to grocery shop? This is something I've heard not just from residents who obviously need food, but also from workers in grocery stores that are stocking shelves and checking folks out. To the degree you can comment on that or are able to comment on that, I can take a swing at it, but...
I'll let you take a swing because
All right.
I was trying to read an article on CNN about that this morning. That would be the limit of my knowledge.
Yeah, I mean, I think the short answer is we just don't know.
Right.
We've seen such a disparity in how the virus affects different folks with not a lot of predictability for age or gender or any other kind of factor. We've seen new information and ever-changing information about how the virus is transmitted and spread. So I think that the general rule is always, of course, operate out of an abundance of caution. If you feel that you are in a compromised health position and can't and don't want to go make a trek to get some groceries, you can call our Project Resilience or fill out that form, or you can call our hotline and we'll get the form filled out for you, and we will bring groceries to you. We'll bring meals to you. If you're in that case, we do have more capacity to deliver more meals. So that the hotline number is 845-443-8888. There are also many other great efforts, town by town. The city of Kingston has been incredible in delivering not just prepared meals, but non-perishable goods and canned goods for folks. The question was from Jane. So Jane, if you don't feel you can go comfortably, reach out to us. But in general, I think if you're taking the proper precautions of distancing, of regular hand washing before, after, during, that it's generally an okay risk to take.
Right. I did my grocery shopping for my family this past Saturday. Went early.
Yep.
Wiped down the cart. Brought my hand hygiene with me.
Yep.
Frequently use it during the store.
Yeah.
So, yep.
Yeah, I think that's good advice. All right, so I know we are pretty much out of time here. I appreciate everybody taking the time to catch up with us. Do you want to add anything to sum it up, Dr. Doyle?
Again, thank you for the time, and thank you for the support of the county. I thank this county's, this great county's great residents for all you're doing. It was a phenomenal display Sunday night. When first responders, fire trucks from the city of Kingston rolled through the hospital parking lot, lights on. What great honor and support from the community. We really appreciate that. That means a lot to the staff there the way we're supported. So thank you all out there for that.
Yeah, and to the degree that you can even take 30 seconds and share with your team, your staff that are on the front lines of this, just, please let them know we have 180,000 people in Ulster County who are pulling for them, who are supporting them, who are thankful to them, who, I think are really realizing how critical of a job this is, and how often it has been thankless, but know that they have our thanks and our appreciation and our support. And if you all need anything, you can let us know, and we'll scream and shout until we get it or die trying. But thank you from me, from my family, from the Ulster County family, for what you all are doing.
Thank you.
So we'll end on that note. Everybody, it's a relatively nice day, so try to enjoy the day safely with some distance, but do enjoy the day, get fresh air. And thank you for tuning in. We'll see you soon.